Okay, I'm going to demonstrate the 4 carpal tunnel stretches that I use on my patients, and then I will show you how to do the self-stretching. As a bonus in between, I will show you how I work the flexor retinaculum to help people that have carpal tunnel syndrome. So let's pretend this patient has carpal tunnel syndrome, which we know it's the median nerve that runs under the flexor retinaculum right here. So what I want to do is I'm going to do 4 stretches. The first stretch I'm going to do is to relieve pressure on the extensors. So I'm going to run my thumb over the top. This is my working hand. I'm putting my thumb over the top of the metacarpals, the heads of the metacarpals, and then I'm going to brace my hand underneath, and then I'm going to plantar flex the wrist. So you can see it at this angle right here. You want to go to where you feel the hard end feel. Okay, not quite bone on bone, but you want to get past that soft tissue feeling there. So I'm going to hold that stretch for about 30 seconds. Release, do it again for 30 seconds, release. Then I'm going to go into dorsiflexion, and we're just going to do the opposite. We're going to take my working hand fingers and put them there in the groove of the posterior aspect of the wrist. I'm going to bring my hand up like this and get as flat as possible, and I'm going to drive those fingers back. Hold on to as many fingers as possible. It can be a little awkward if your hands are small, mine are big, but you want to go ahead and go back as far as you can until either you see the patient wincing or you feel that hard end feel where it almost feels like it's bone on bone. You don't want to let the thumb slip through. That's no good. You want the thumb to be a part of the stretch. Again, 30 seconds, relax, 30 seconds, relax. Okay, so we had dorsiflexion, plantar flexion. Now what we're going to do is external rotation. And the way we do that is I bring my hand over the top of the other hand, take my thumb on the thenar eminence, and I pin just above the carpal bones on the radius and ulna so it doesn't move, and then I externally rotate away. So I'm externally rotating. And you just do the opposite for internal rotation. You put your hand over the top, you hook with your thumb this way, and you twist internally like that. So you get a hold. So again, it's going to be 30 seconds and 30 seconds in both directions. Those are going to be the 4 main stretches that I like to do. I'm going to teach you at the end of the video how to do it on the wall at home so you can help yourself. Now, as far as the carpal tunnel work itself, I'm going to make sure that we're working this flexor retinaculum through here. And I'm going to use thumb driving. So I'm holding it with the working or the holding hand, and then I work it with my thumb, and I use little tiny little baby steps just like this across the flexor retinaculum itself, which holds down the flexor tendons. And you're going to want to work into that thenar eminence, that thumb pad, and I'm going to work like this whole area here. Now I actually have a video on how to work the flexor retinaculum really well. I'm doing kind of a speed version for you guys today because so many people are coming in saying, what can I do at home? But I actually have a detailed video. I'll put it at the end of this video so you can see that. But you can just see I'm just doing some gentle work all through the wrist here, just like that. And you can actually get your fingers in between, and you can dorsiflex the wrist, and you can walk up inside there. But here's a secret about carpal tunnel syndrome, is you want to work all the way up into those flexors. So I thumb walk all the way up into those flexors, into the forearm itself. And I'm doing what basically like guitar strings. You kind of just move over just a little bit, and you'll find little knots in the muscles all through here. You'll find little tiny knots, which we call trigger points. If you bring relief all the way up to the elbow of the patient, all the way down here, and do those 4 stretches, and then give them the assignment on how to stretch at home, you're going to open this whole thing up. So let's go to the wall and we'll demonstrate the hand stretches. So now we'll demonstrate what we're going to do for the patient. We're going to tell them how to do this particular stretch. And the way we do this is we make sure that the shoulders are parallel to the wall. They're not twisted right or left towards the wall. They're completely square to the wall, and you're just about arm's length away. And what I'm going to do is I'm going to put my hand directly flat against the wall, and I'm going to make sure that the elbow is locked out. We don't want to have the elbow break to get away from the stretch. We want this arm to be really tight. We want the elbow to be locked out. And we want to make sure this plantar pad here is flat against the wall itself. So as I go down the wall, I'm going to feel the stretch in the flexor tendons of the arm. I go down a little further, I'm going to feel the flexor tendons stretch. I can keep going down further and further until all of a sudden my wrist comes off the wall. Then I know that the stretch is no longer working. It's not going to work, because if you get down this far and your finger, and all you have is your fingertips, that's no good. We want to make sure that that hand is against the wall. We want to make sure that this arm is locked out. Okay, so that's how we stretch the flexor tendons. Now the extensors, we simply do the opposite. We put the dorsi aspect of the wrist against the wall. We make sure it's nice and tight. We lock out the elbow, and we work our way up the wall until the wrist starts to come off the wall. Now I can really feel the stretch in my extensors. I can feel it in my extensors, and I even feel it a little bit in the brachioradialis of the forearm itself. So these are going to be the two main stretches that you're going to have them do. You're going to have them find where the stretch is not hurts the most, but is most uncomfortable, but they still have their wrist flat against the wall. And then you're going to tell them to hold that for 30 seconds. Just like they do when you're working on them, you know, and you're doing the passive stretching here. They're now involved in active stretching, and you're just going to have them hold for 30 seconds. And then if they can go up a little further, another 30 seconds. If they go up a little further, another 30 seconds. Okay? And then same thing if we go down the wall like this, 30 seconds, 30 seconds. Have them do that on both hands. Stretch those forearms at least twice a day. And after a couple of weeks, between your work on your patients, your work yourself, and them doing the home stretching, they're going to get a lot of relief naturally for carpal tunnel syndrome. If you enjoyed this tip, please hit like and subscribe. And just remember this, if there's no discomfort on the table, well, we know it was nothing more than a foo-foo massage.